Hello. So, if you're a parent, you have probably had one of those nights. You know the one, you're woken up by your child crying. They're complaining about their legs aching, and there's just no obvious reason why. It's really worrying, it's confusing, and we usually call it growing pains. Well, today, we're going to demystify this whole thing. Let's pull back the curtain on these mysterious aches and pains.
It's such a classic and honestly frustrating scenario, right? Your kid is running around all day, totally fine. But then, bam, middle of the night, they're awake and they are so distressed, pointing to their legs. Your mind just starts racing. Did they get hurt? Are they getting sick? What is going on? It's a question that has puzzled parents for a long, long time.
Okay, so first things first, we are going to decode growing pains. We're talking the what, the who, and the when. Let's get some real clarity on this.
So, what are we really talking about here? Well, the official medical term is benign nocturnal limb pains, which, yeah, I know is a total mouthful. But let's break it down. Benign just means it's harmless, and nocturnal means, you guessed it, it happens at night. It's what's known as a diagnosis of exclusion. That just means doctors have to be detectives. They have to rule out everything else before they can land on, yep, it's growing pains.
And here's where it gets really interesting. That name, growing pains, it's pretty misleading. Get this. Despite what it's called, there is no solid scientific evidence that these pains have anything to do with the actual process of growing. It's just one of those terms that has really stuck around over the years. So how can you be pretty sure that's what's going on? Well, there's a classic pattern to look for. The pain is bad enough to wake them up and they're genuinely upset. It's usually this deep ache in the muscles like the thighs or calves, not in the joints themselves. And it typically lasts about 20 or 30 minutes. Now, this is the really crucial part. There are no other symptoms, no fever, no swelling, no limp the next day. And this right here, this is maybe the most baffling, but also the most reassuring part of the whole thing. The contrast is just stark. One minute, your child is completely miserable, and the next morning, it's like nothing ever happened. They're up, they're running around, totally fine. For parents, that's a huge clue. Now, if this is all sounding way too familiar, listen up. You are so far from alone. Growing pains can affect up to 1 in 4 children. Think about that for a second. That's an incredibly common part of childhood.
So, who gets them? Well, the prime time is usually between 3 and 7 years old, but you can definitely see it pop up in older kids too. It affects boys and girls pretty much equally. And here's a little fun fact. It often runs in families. So if you had them as a kid, there's a decent chance your child might get them too. Okay, so we've got a handle on what growing pains look like, but now we're at the million-dollar question, aren't we? What is actually causing them?
This is the question every single parent asks. If it's not their bones stretching, if it's not their muscles literally getting bigger, then what on earth is causing so much real pain in the middle of the night?
So let's put the myth right next to the leading theory. The old wives' tale is that it's the bones growing that hurts. But the explanation that makes the most sense today is actually much simpler. It's just muscle fatigue. I mean, think about your kid's day. They run, they jump, they climb, they never stop. Their little muscles get worn out, and that tiredness can show up as aches and pains later on once everything is still and quiet.
But here's the honest truth. While that muscle tiredness theory makes a ton of sense, the exact cause is still officially uncertain. There's no 100% proof. The one thing the scientific community does agree on, though, is that the direct link to the physical act of growing just isn't there. All right, now for what's probably the most important part. Knowing the what and the why is great, but when you're a parent at 2 a.m., what you really need is the how. How can you actually help your child when they're hurting? Let's build your comfort playbook. This might sound almost too simple, but please do not underestimate how powerful this is. Your child is upset. They're probably a little scared. They're confused. Your calm, reassuring presence, you telling them that this is normal and that it's going to pass, that is the single most effective tool you have. It's so much more than just comfort. It's a huge part of the treatment. So here it is, a simple plan you can remember in the middle of the night. Step 1, reassure and cuddle. Your closeness and your calm voice are going to do most of the work. Step 2, gentle massage. Just soothingly rubbing their thighs or calves can feel amazing. And step 3, you might consider a simple pain reliever, like one for children. This can be especially helpful if you notice the pains tend to happen after really active days. But of course, you should always check with your doctor first.
I mean, this quote just says it all, doesn't it? When you boil it all down, past all the medical terms and theories, this is the fundamental truth. The best medicine is just tender, loving care. It's your attention, your touch, your reassurance. It's just being there.
So what's the long-term forecast here? Is this something you have to deal with forever? Let's take a look at the outlook for a child who gets growing pains. This timeline gives you a fantastic bird's eye view. The pains might start in the toddler years. They usually peak during preschool and early elementary school, and then they just naturally fade away. By the time your child is in late childhood or their early teens, this whole phase will just be a distant memory. And here it is. This might be the most important message of all. Growing pains resolve on their own, and they leave behind zero lasting damage or ill effects. They are a temporary, totally harmless, albeit very frustrating part of growing up for some kids. So, for any parent who's listening to this, for anyone who's been awake in the middle of the night, rubbing their child's aching legs and feeling that sense of helplessness, just remember this. It is a phase, and like this says, so simply and so perfectly, this too shall pass. So to wrap this all up, let's just reflect for a moment. We've seen just how incredibly powerful simple reassurance is when it comes to growing pains. And it kind of makes you wonder, doesn't it? In a world that is just full of complex parenting advice, how many of our other challenges, from tantrums to bedtime fears, could be soothed by that same fundamental tool, our calm, loving, and reassuring presence? Just something to think about. Thanks so much for watching.